Hello everyone, a very good noon to you. Welcome to another session of Assurance Talks. And so our today's session is about mosquito-borne threats in monsoon, understanding dengue. So let me get started. And before taking much of your time, let me quickly introduce Dr. Seema, which is a family medicine physician with 18 plus years of clinical experience. So we'll do a Q&A session. If you have any questions, we'll take it at the end of the session. So hi, Dr. Seema, a very good noon to you.
Good afternoon, Dr. Ayushi. Thank you for having me. So we'll be talking about.
Yes, so I have few questions listed down. So let's get started. I know that most of the people have a lot of questions and queries when we come to know about dengue because there are a lot of myths and the only clinician knows the fact.
Right.
Yeah, so let's get started.
Go ahead.
Why knowing about dengue is important? Jan, let's start with this.
Yeah. So dengue is a disease that has got some features not everybody is aware of. So it's very important to know, get yourself oriented and to know the features like what it is and how bad it is or how good it is. Regarding that kind of perspective, it's important to know about dengue.
So is dengue always dangerous or we say fatal?
Yeah, good question. So a lot of people have this misconception once you have dengue, like it's going to be dangerous and critical and people have to be admitted in the hospital. It's not that way. Once a mosquito bites a person, patient gets dengue, and if you test in the lab, it's going to be positive, right? But not all people have the symptoms. There are some people who are asymptomatic. They don't have any symptoms at all, yet if you test them, they are positive, right? And there are some people who do have symptoms and they are like mild to moderate, and that's it, they recover. And whereas some people have there is a portion of the population that is having severe dengue symptoms.
So not everybody actually gets vomiting and fever kind of symptoms.
Right. Not everybody exhibits the symptoms. Yeah.
Okay, so what are those critical symptoms that we say it's dangerous when it comes to?
First, I'll deal with the common symptoms for the dengue. Yeah. So in the dengue fever, you will get fever, of course, and you will have severe body aches. Okay. So that is why it is called as break-bone fever. Haddi tod fever it is called. Yeah. Right, so that is why severe, headache they have and pain behind the eyes. They'll have mild sore throat. They might have nausea, vomitings, diarrhea. And some people also have the rash, which is like a measles rash.
Okay.
So, and eventually this happens after the mosquito bite, like 3 to 7 days after the mosquito bites. So 3 to 7 days is an incubation period. Well, that is not very important. What is important is the symptoms. These are the common symptoms. Not everybody will have all the symptoms, and not everybody will have the symptoms. Yeah.
Okay. So what are the warning signs that we can talk about that actually leads to the serious condition of
right? So this is the important part. That is why knowing about dengue is important, right? So as I told you, the dengue has got two components. One is normal, recovery period and normal mild symptoms or moderate symptoms. But there is something called dengue hemorrhagic fever and dengue shock syndrome. These are the two things that happen in severe dengue fever, and people should be aware of the symptoms so that they know where they stand, and they can take a decision whether the patient has to be admitted in the hospital or can be taken care at home. So what are those warning signs? Patient will have like puffiness of the face, here swelling on the feet and the hands, and he might have experiencing discomfort in breathing, and he will have blackish stools, He might vomiting continuously. Vomiting is also not a good sign. That will cause dehydration, and that will lead to severe symptoms. So these are the things, and yeah, he'll have like restlessness, irritability, severe fatigue, so at abdominal enlargement and pain in the abdomen. So that's because the liver gets enlarged. So these are the few warning signs, and patient will also experience bleeding from the gums, nasal bleeding also sometimes. So these are the things that you know that it is very important to consult a doctor and go about this, like what to do about this. And basic investigations have to be done, like what is the platelet level and hematocrit level. These are two very important things that will decide the course of the illness. Yes.
Okay. That something that in detail.
Yeah,
even
this
I
is
got
very
to know,
important.
yeah.
Yeah, this is
So is there a specific criteria when it comes to that who will get the dengue, or like who will get the serious
Right.
symptoms?
Right. So this is also one of the important questions that common people should be aware of. One is that people with diabetes, pregnant ladies, and the extreme age spectrum, very young and very old, and people who are immunocompromised, people who are having HIV, people on steroids, like asthmatic people regularly on steroids. These people have low immunity. They, in that kind of population, the dengue can get severe, right? So these people should be aware. Another thing is important thing many people are not aware is that once you get a dengue fever, that is primary infection. And then when you get infected again the next year, then the chances of dengue becoming severe is more. Invariably, it happens.
So if you are getting it like second times, it might get even
right. Right. So people have to, especially the ones who've already been infected, they have to take extra care not to get bitten by the mosquito, take all the precautions, because the second dengue infection is going to be serious. Yeah. Yeah.
So because this is something that even I was not aware, when we talk about that, we usually feel like that you get somewhat immunized about when you're getting infected, like first time and second time it might not be severe.
That's
general perspective, we take it like that.
Yeah, in dengue, something that's a complex antibody antigen mechanism that happens, immunity related, like cytokine storm that happens in COVID, something like that. It's a little complex to explain, but the people, general people should know that once you get infected with dengue, the second dengue infection might be more severe.
Okay. So then when it comes to that status, so how can we actually prevent or protect ourselves from getting infected or
serious? As in with every disease, prevention plays a great role in this. So the prevention is, of course, from the mosquitoes. You have to protect yourself from the mosquitoes, especially in rainy season. That is the time where the breeding of mosquitoes happen. And we should not let stagnant water be around your locality, in your house, standing water, pools, puddles, potholes, and even the garden garbage, leaves, kitchen garbage. This should not be kept in open, because that is a perfect breeding ground for mosquitoes to lay eggs and breed. So they say if they breed, you bleed. So that's a funny way of
That's right.
So it's very important to protect yourself from mosquitoes. You can have mosquito nets, you can have insecticides, fumigation, like the municipality does fumigation in certain endemic areas where the mosquito are more prone to develop. And use mosquito nets, use mosquito repellents. Have full sleeves clothes to protect yourself. And this Anopheles mosquito that is especially in dengue, causing dengue, especially bites in the daytime, especially during sunrise and sunset. So close your doors, have mosquito mesh installed in your windows and all that. So these are the general precautions you have to take.
Nice.
Prevention
so just like correct.
Yeah.
So on that, I have a little bit of personal question. So like you said that they are more active in the sunrise time and the sunset time. So there is a bit of, I don't know whether it's a myth or it's a fact, that it's been told that dengue mosquito does not bite at the night time.
It's not like 100% true. But usually Anopheles mosquito, that is the one that causes dengue, is active during the daytime.
Okay.
So, but it's not like 100%, it will not bite in the night, but most care is to be taken during the day, these times, as I mentioned.
Okay, so it's like any time, I mean, probably mostly in the
Mostly
daytime,
during the
but
daytime.
yeah, anytime they
Yeah,
can.
That's
actually
probably in the
bite.
night,
Yeah.
but yeah.
And we are not getting any immunity if we get infected first.
Actually, there's the 4 types of viruses that cause dengue by the mosquito. And once you get infected, bitten by a mosquito, that you get develop immunity to one kind of virus only. But there are 3 others there. And then, yeah, so immunity is not lifelong. Even if you develop immunity for one type, there are 3 others. You get infected again.
It's not like that small.
Not lifelong. Yeah, not lifelong. Yeah.
Okay. So what exactly is the treatment when it comes to the treatment part of dengue?
Right. This is very important also. So what happens in dengue, as everybody knows, platelets fall. There's a downward trend of platelets. So people should keep an eye on it. Persons who already have low platelets to start with, that should be regularly monitored, if not daily. All right. And then hematocrit is something that is also shows like how much water is lost. So when people during in the treatment part, people usually have nausea and anorexia, that is lack of appetite. So they should eat small meals at regular time, nutritious meals, and drink plenty of water. It's very important to be hydrated, well hydrated, because that will prevent you complications from happening, and that will prevent you from landing in the hospital. What happens is that when you're vomiting and all, when you don't have an appetite, you don't eat and you don't drink. Even if you don't eat, drinking is very important, right? The platelets will fall, but it will not, unless it's like critical, patient will not suffer much. It will not be like critically falling below 10,000. Usually the platelet count is like 2 lakhs to 4 lakhs, 5 lakhs. So if it is fall below 10,000, something that is concerning. But until then, if the patient is well hydrated, even he's having 20,000, he'll do well. He can recover well.
So
important
the
to
home
have
care
fluids.
can.
Exactly. Patient can, in this stage, patient can be taken care of at home. Just monitor the temperature and let him have plenty of fluids. Avoid carbonated drinks, avoid tea, have plenty of fluids which are, give you water.
Correct.
Yeah.
Yeah, so that was a lot of information to take, but no, definitely, I know that many people actually don't know what to do and how to do it.
Yeah, how to.
So yeah, and market, there are lots of myths.
Yeah.
So yeah, no, thank you so much for all the insights, and this, I know personally that this is very helpful.
This is,
yeah. So thank you so much. So now that we have seen the clinical part, let's go on, see how diet actually affects our dengue. And
thank you, Arushi. Have a nice day.
Thank you so much. That was a great talk, and no, we actually got to know a lot of things.
Yeah,
even
stuff.
Yeah, even I had too many of myths when
Mm-hmm.
we talk about
Right.
So let me introduce to our dietitian. Let me introduce to Sravanthi. She is our clinical expert dietitian. She has experience of 7+ years and expert in weight loss and diabetes management. So hi Sravanthi, I welcome you to our assurance talk. So I hope you are having a good day.
Yeah, hi Arushi. Thank you for for organizing this webinar, and yeah, hope you are doing good.
Yeah, definitely. So for you also, I have like lots of questions. So of course, no one better than you knows what to actually have in a meal so that we can actually get that kind of immunity to fight such a infection. So let's get started.
Sure.
So first of all, the most basic question that how does nutrition play a role in dengue management?
Yeah. So actually, nutrition plays a crucial role in managing this dengue, because there is no specific antiviral treatment for dengue, first of all. So in that case, definitely to manage the symptoms, to recover from the dengue, and to recover from the post-dengue symptoms and the weakness, diet plays a major role in providing good immunity and providing good strength and nutrients to the body.
That's right, because I know that there is no antiviral kind of medicine. So
Yes.
okay, so what are the key dietary recommendations that you give to dengue patients?
Yeah. So generally we recommend first of all a proper nutrition, secondary nutrient-rich foods, third is good amount of protein, and fourth is omega-3 fatty acid. So these are the four essential things dengue patient need to look after. So when it comes to hydration, a person need to take good amount of adequate fluid intake should be there. Like they can include some soups, fresh fruit juices which are homemade, and then they can also have some they can have fresh fruit juices, soups, and some drinks like buttermilk. Okay, these all kind of liquids they can have, and even the water also, when they are having water, they need to boil it and cool it, then they can take that, because in the monsoon season there will be infections through the water also. So we have to make sure that water is boiled and cooled, and then it has to be taken. And whatever the fruit juices you are taking now, that fruits also should be washed thoroughly, and then that juice need to be prepared considering the hygiene and all, and it should be homemade, not should not get it from outside or from somewhere. Okay, and coconut water also can be given, and buttermilk. If like buttermilk, you can add some mint leaves or mint leaf extract to the buttermilk, and also can add some ginger extract to the buttermilk, so that it will be somewhat tasty. And you generally the patient will be having nausea and vomitings. There will be so much electrolyte loss also in the body. So at this time, if we can give these kind of liquids to the patient, then that will help them to stay hydrated, and complications will be less. And secondary is the nutrient-rich foods. Nutrient-rich foods are like the balanced diet. Even for a normal person also, it is important to have a balanced diet which contains all the vitamins, minerals, and the all the other essential micronutrients and macronutrients. So especially in dengue, they require vitamin C mostly to build their immune system, and vitamin A, and they need zinc and selenium. These all nutrients will help in fighting against the viral infection.
Right.
And mostly they can prefer like oranges, sweet limes, kiwi, papaya, and amla. That is also fine. And some seeds and nuts like Brazil nuts, flax seeds, and chia seeds, and even protein also. For protein, they can depend on some pulses like rajma or some red gram dal for their lunch. They can have some softly cooked dal and softly cooked rice for their lunch. So in that way, they can have these kind of foods to get proper nutrition to the body, and that helps in faster recovery also. And when it comes to omega-3 fatty acids, they are found in flax seeds and the fish also. But and even the protein also we can get from plant and animal as well. So we need to choose whether to take the animal protein or the plant protein, because animal protein is something which is not easily digestible. Generally, when the patient is on bed and taking and undergoing some treatment, so we have to give them the easily digestible food.
Agreed. So, so you will prefer a plant-based protein to people who are suffering from dengue, and for post-dengue, I mean, recovery, the animal-based protein.
Actually, it is not like they have to avoid non-veg, but my suggestion is that it would be better if they depend on the plant-based protein and plant-based omega-3 fatty acids, because we get protein from chicken, meat, and also. But the thing is, when patient is undergoing treatment, their digestive system will be low, like so there will be slow digestive system. And then what happens, if in this monsoon season, there most of the birds and the animals will get infected. Okay, so already the patient is having infection, and again we are giving them knowledge that is not safe. So by considering this, we can switch to plant-based protein, which is safe and easily digestible. And one more thing is, non-veg item, any non-veg item will take so much time to digest. So normal food will be digested within 2 hours or 3 hours. So that is my suggestion. And one more thing is, even if it is a fish also, post recovery, fish, mutton, or chicken, anything post recovery they can have that, because even if the patient is out of danger and if the fever subsides and if he is out of the dengue, the post symptoms will be there. There will be weakness and the muscle pain. So to cope up with that, they can switch to the normal balanced diet, and they can include this animal protein also.
Right. So just just on a lighter note, so when you say to keep hydrated or have lots of liquid, can we take alcohol?
No, alcohol is also a liquid, but it's not advisable. It's not advisable. Not even tea, coffee, and some erected drinks and alcohol. These all need to be avoided, strictly avoided, because that causes dehydration again, and that will lead to the complications. So liquids, there are some good liquids, like you can depend on the fruit juices, vegetable soups, and porridge, and these kind of liquids they can have.
Simple bimar like
Yes, not alcohol. It's liquid, I agree, but not alcohol.
Okay, so how nutrition actually helps in the prevention of dengue?
Dengue is something purely caused by mosquito bite, not with some infection, not some other kind of source. So the main source is, the main cause of dengue is mosquito bite. The only prevention is we have to protect ourselves from mosquito bite. There is nothing to do with the diet or food. There is nothing like if you eat this food, you can prevent dengue. The only thing I can tell you is you should have a strong immune system. If you have a strong immune system, even if you fall sick, you can recover faster, and you can you will be having less symptoms. You will be able to bear the symptoms. If you are very weak, you will not be able to bear the symptoms. Even a small pain also you will not be able to bear, and it takes some time to recover. Okay, there will be complications also. So for a normal person also, or a person who is having dengue also, the main thing is they should have a balanced diet which contains all the vitamins, minerals, nutrients, and all. So these kind of nutrients help the body to build a strong immune system. When you have a strong immune system, definitely you will be out of the danger. Mostly you can avoid the complications.
Yeah, right. No, exactly. That's the point, because the post dengue also they have very severe weakness, and so yeah, we need that kind of immune system to get through it.
Yes.
So how you actually build a strong immune system? Can we do that entirely with a good diet?
Yes, generally to build a strong immune system, vitamin C helps a lot. Vitamin C, like that vitamin C, the sources of vitamin C are oranges, sweet limes, kiwi, amla, and some broccoli, and you can have papaya also. These kind of foods are rich in vitamin C. They help in treating with the inflammation, and they have antioxidants. They fight against the infection. And some nutrients like zinc and selenium, these are also the essential nutrients which find out the virus and they fight against the virus. So these the foods which are rich in vitamin C need to be taken more to build a strong immune system. And not only vitamin C. See, if you are taking vitamin C and if you are lagging vitamin D, then that will also affect that there will be effect on your immunity again. When your vitamin D levels are low, then your immune system also will get affected. So you will have slow immune system when your vitamin D is low. Okay, so you have to make sure that you are taking a well-balanced diet so that all the nutrients you get and your body will be prepared, your body will be fit to fight against any kind of infection.
Yeah, that was
Yeah.
great insight.
Yeah, I like vitamin C helps in building immunity. If you have immunity, like there are other factors also which are associated with immunity. So we have to consider that also, and that we get from a proper, well-balanced diet.
Yeah, I completely agree because I know on the basic knowledge that vitamin C actually helps you build the immune system, but I had no idea that vitamin D interact with that, and if that's slow, then it's a waste.
And what happens is, I want to add a point. During the monsoon, there won't be enough sunlight. The main
Right,
source of
right,
vitamin D
right.
is sunlight.
Sunlight.
So when there is no vitamin D, there will be slow digestion. Okay, and so we have to have some softly cooked food during this monsoon seasons, and also for the dengue patients, especially considering that vitamin D also is important.
So I know I don't know whether it's a fact or it's a myth that papaya juice is considered as a remedy for dengue treatment.
Yeah, so I don't say directly no to this answer because there are few cases like it worked for few people. But the thing is, before using that, we need to consider a few things. That firstly, it is not scientifically proven. There is no scientific evidence for that. That we need to consider. And secondly, patient will be already having this nausea, vomiting, and they are not able to have a normal food also. Even if we give some tasty food or tasty drink also, they won't be able to have that. But in such case, if you are giving papaya leaf extract, which is very bad at taste, that will again cause nausea and vomiting, and that will lead to dehydration and complications. So we have to consider this also. And if the people who are having weaker immune system, there will be some adverse reactions with this also. And there are few capsules which are made of papaya extract, but that purely depends upon the physician who is treating the doctor, who is treating the patient. Like that decision need to be taken by the physician whether to go with the capsule or not. That it is a mechanical extraction, so can be preferred, but that depends upon the physician.
Okay, so we have to consider the clinical expert advertise that okay, yes, that you need to know that this is right and this is wrong.
Yeah, based upon the patient condition, symptoms, they will be advising if required.
Correct. So I mean, I know this a bit too much, but on a personal note, if I want to know that any quick recipe or something that quickly will boost your energy or something that we can take while we are suffering from dengue,
Yeah,
what would you suggest?
so mainly when a patient is having dengue, there will be a lot of weakness.
Correct.
And they cannot like they cannot eat also. The taste also matters now.
Right.
So what they can do is they can have banana with curd, because this helps in diarrhea. Also, that helps in treating diarrhea, and also it is easily digestible, and they get good amount of protein and calcium from the curd. And from banana, vitamin C and other nutrients they get, which helps in boosting their immunity, that gives energy, and also it has good amount of protein. So to this, you can even add some amount of flaxseed powder, a little bit of honey, the organic honey, not the syrups or the jaggery syrup we get now. So we have to choose the good one. So this recipe we can give to the dengue patient. And also, if they are not comfortable taking it with the curd, they can take it with milk also. They can add some walnut powder to that. Okay, walnuts powder, because walnut is not good at taste, they cannot eat it directly. They can powder it and they can have mix that powder with banana milk and that powder and little bit of honey, and they can have this. That instantly gives them energy. And they can prepare some porridge also, like oat porridge or ragi porridge, and they can add some flax seeds powder to that, and they can have that so that they get their omega-3 fatty acids. Omega-3 fatty acids generally deal with inflammation. Patients who are having dengue, they'll be having inflammation also. So when they take good amount of omega-3 fatty acids, that helps in dealing with this inflammation.
Okay. So thank you so much, Sravanthi. That was a great talk, and I'll try this personally. So yeah.
Yeah, but generally, even if a patient is not having dengue, if not a dengue patient also, in general also we can have that.
To boost
That's a good,
personally, I need some immunity to boost. I'll take that advice in figures. So thank you so much. I know it will be a great help to all the people who get to hear this webinar and talk on this. So thank you so much for your insights. And so just to do a little recap, let me share the recap slide with you all. So basically, what we discussed today was about having knowledge about dengue is important. Not every dengue infection is dangerous. However, it's important to be aware of its symptoms and how to monitor them. A strong immune system helps in speedy recovery from dengue. Is home treatment an option? When is a hospital stay necessary? Dengue shock syndrome signs and symptoms. Why prioritizing prevention through protection holds significance? Vitamin C rich foods such as oranges, kiwi, sweet lime, papaya, pomegranate helps in building strong immunity. Prefer homemade, softly cooked, easily digestible food if you have dengue. Having adequate fluids will help you to stay hydrated, which is essential to avoid dengue complications. Realize when hydration is setting in, avoid beverages like tea, coffee, cold drinks, and alcohol, of course. Who should take a particular care? Always seek for doctor's opinion. Do not rely on any remedy without consulting health experts. So on this note, I would like to thank both Dr. Seema and Sravanthi, and also to all of you for joining this session. And if you missed anything, you can anytime log into our channel and look into the whole session. And also just inform that NH Assurance offers a comprehensive program to manage early stage dengue at home. So we know that almost 95, I'll say 95 to 99% of people can be taken care at home itself. So please reach out to us if you need any help. Don't get to an emergency stage, and so that patients, you all can receive a proper guidance on medication, or you want to boost your immunity, or it's also crucial to get a speedy recovery once the dengue is done. So please do contact us, and be safe and have good food, and you can anytime log into our channel and view this session. Thank you all for joining us, and have a good day.
Thank you.
Thank you all. Thank you, Sravanthi.
Thank you.
Thank you. Bye-bye. Thank you all.